You don't burn out from laziness. You burn out because the system keeps asking you to do the impossible, then blames you for failing physics. It's 9:07 in the morning, and a nurse is already an hour into a 12-hour shift. 6 patients on paper, all marked level 1. But in reality, every single one of them feels like level 2. Down the corridor, a junior doctor logs back in to check just a quick follow-up after finishing a night shift, because the rota is full of gaps. Across town, a GP opens 250 test results at 7:58 a.m. and watches the phone lines melt at 8 a.m. This isn't drama. This is just Tuesday. And this is why the NHS is running on fumes. Listen to the numbers. Really listen. In the latest National NHS Staff Survey, with hundreds and thousands of staff responding, only 1 in 3 say that there are enough people on their shift to do the job properly. 1 in 3 feel emotionally exhausted, often or always. Nearly half finish most days completely worn out. Among doctors in training, 1 in 5 are at high risk of burnout. About half of their trainers are too. That's not background noise. That's the smoke alarm that's been beeping for years, while we pretended it was just the toaster. It's apologizing for delays you didn't cause. It's documenting everything twice because 2 computer systems refuse to speak to each other. It's missing lunch again because the queue outside your door never ever ends. Meanwhile, the waiting list hovers in 7 to 8 million range. A&E 4-hour performance has never recovered from 2010. Ambulance response times bounce around like a yo-yo, always above target. Staff sickness is stubbornly high, with stress, anxiety, and depression leading the charge. We spent billions on temporary staffing, bank shifts, agency nurses, premium rates to fill the holes we created by not keeping the people we had. If you want a single photograph of a systemic failure, there it is. Paying double to patch what we broke. Even after the much-publicized junior doctor strikes of 2025, which dragged pay into the headlines, real-term wages are still 20% down from 2008. 20%. The dispute wasn't just about money. It was about the principle that saving lives shouldn't come with a decade of pay erosion. And it's not just the doctors. Early career nurses start with a degree, registration fees, and maintenance grants that barely cover the rent in most cities. We recruit people into life and death work, then make them calculate parking fees and mortgage rates before they can think about medicine. Now, politics. In 2024, Lord Ara Darcy, who wrote the famous Next Stage Review in 2008, was asked to take a hard look at the NHS again. His verdict: the NHS is still worth defending. But we're underpowered on capital, under-tooled on technology, and drowning in bureaucracy. We've sweated our assets to breaking point. Too few scanners, not enough operating time, buildings with a maintenance backlog in tens of billions, and IT systems that make logging in feel like entering a nuclear bunker. Sure, we have plans. The NHS long-term workforce plan sounds ambitious. Double medical school places. Increase GP training by 50%. Expand nursing and apprenticeships. But here's the thing about turning up the tap when your bucket still leaks. You never fill the bath. Staff leave after 3, 5, 7 years, and all that training gone. And you can't grow trainees without growing trainers. Clinical educators don't appear by magic. The current Labour government talks about reform with realism. More evening and weekend sessions, more community and diagnostic centres, digital front doors, less bureaucracy. But fiscal rules are tight, productivity is flat, and the gap between promises and funded delivery, that's where clinicians actually live. Reform only works if someone pays for the theatre nurses, the recovery staff, the porters, the scanners, and the electricity to run them all. Let's talk about bureaucracy, the silent workload. Ask any ward sister, matron, registrar, GP partner, or pharmacist. They'll tell you the NHS has too many layers telling people what to do and too few people actually doing it. We've built a maze. Department of Health and Social Care, NHS England, Integrated Care System and boards, trusts and foundation trusts and PCNs and GP practices. And inside each, boards, committees, oversight groups, programme boards, and steering groups. Every layer adds reporting, assurance, dashboards, and crucially, delay. Healthcare professionals carry the cost of delay as overtime and burnout. Patients carry it as waiting times. Then there's duplication. Multiple electronic systems that don't talk, so the same allergy list gets typed 3 times. A community nurse writes notes in a laptop. A practice sees the scanned PDF 2 days later. The hospital never sees either. One login for pathology, another for radiology, an old temporary system still used for discharge letters because the new EPR module never fully landed. That's not an IT gripe. That is hours of clinical time per week per person lost. Darcy called it out. The workforce plan assumes digital productivity, and yet the default day at a coalface still involves ringing switchboard to bleep someone because the secure messaging is coming next quarter. We waste tens of millions on interpreting services. Necessary for safety, but bought badly. But the real hemorrhaging, vacancies and churn. Every empty position means longer waits and premium shifts. Estates with maintenance backlogs in the tens of billions, where one broken air system can cancel entire days' operations. Fragmented procurement where the same equipment costs different amounts in different places. Administrative duplication that feeds a paper beast while draining the life out of people trying to heal. So, why are doctors and nurses burning out? Because we built a system that asks them to perform miracles with broken tools. Because we've created a machine that devours compassion and spits out statistics. Because we've taken the most dedicated people in our society, people who choose to dedicate their lives to healing others, and we've trapped them in a maze of bureaucracy where saving lives comes second to hitting targets. They're burning out because we give them 6 patients who need the attention of 12, then blame them when someone falls through the cracks. They're burning out because we make them fight the computer system as hard as they fight diseases. They're burning out because we've turned healers into data entry clerks, caregivers into box tickers, and lifesavers into cost centers. But here's the truth that nobody wants to hear. They're not burning out because they're weak. They're burning out because they're strong enough to keep trying in a system designed to break them. They're burning out because they cared too much to walk away from patients who need them, even when the system has walked away from the staff. The smoke alarm isn't just beeping anymore. The house is on fire. And we're asking doctors and nurses to save us all while we watch them burn. Thanks for tuning in today. If you found this video useful, please make sure you like, share, and subscribe to my channel. It helps me immensely. It helps this movement grow and reach wider audience. Until next time, stay safe, folks.